All right, everyone. So we're going to talk about emotional health and well-being now. We already set the stage talking about general emotions, how they're regulated, how they're expressed in teenagers. But now let's dive into emotional health and well-being, a very important topic. So first of all, we want to distinguish between internalizing and externalizing problems. So there's a lot of challenges in adolescence, of course. We know this. And for some, these challenges either aggravate pre-existing problems or they create conditions for new problems to emerge. And that leads us to internalizing and externalizing problems. So emotional health can be split into two categories, the two that we're going to discuss now. So internalizing problems would be disturbances in emotion and mood. So we can think depression, anxiety, worry, guilt. And internalizing problems are more common among girls. What about externalizing? So on the other end, we have social and behavioral problems, things like aggression and delinquency, anything that would be considered acting out. So we can think like skipping school, running away, drug use, vandalism, getting into fights. These would be externalizing problems, and these are typically more common among boys. So there's just setting the stage here and noticing some gender differences right away. Now let's dive into internalizing a bit more now. So it's a little blurry and very tedious and small. You don't need to see all the details here, but I want you to notice the difference in the colored bars. So orange represents girls and green represents boys. And these are all internalizing problems that are being measured here. So things like, nervous, worried, or anxious. Or on this side, we have like serious depression down here, or sad, unhappy, or low. So it's a number of internalizing problems. And you can see almost across the board, these orange bars are higher than the green bars. And again, orange represents girls. So just to kind of paint a further picture about the gender differences, we do see internalizing patterns more common among girls. Almost across the board, we see that here. So, and most of these problems do increase as they grow older. We can see that too, because each of these 5 sections is going up in age, going from 11, 13, and 15 years old. And we can see they're kind of getting more exacerbated as time goes on. So just wanted to set the stage by showing you that, showing you some numbers and patterns. Now let's talk about depression and anxiety. These are among the most common psychological problems of adolescence. Now, depression is not to be confused with depressed mood. Now, this would just be an episode of sadness. It goes away after a while. And it's experienced by virtually everyone. We all have off days, right? Where we just feel down. That would be a depressed mood. And while it's not pleasant, it's also not the same as a depressive order. So we just want to distinguish the two. So depressive disorder is more than just sadness. It's a daily way of being. So it's more long-term. It's impacting everyday functioning, and it actually may require treatment. So some signs could be feeling tired every day, or sleeping too much or too little, eating too much or too little, maybe lack of interest in activities, possibly even feeling worthless or hopeless. These are characteristics of depression. Now, in terms of adolescence, by age 15, girls are about twice as likely as boys to experience serious depression. And interestingly, there's a correlation between puberty and depression among girls. So perhaps it's due to some of the challenges specifically faced by girls during puberty, like we discussed in the previous chapter. So that's setting the stage for depression. And yes, it is twice as likely among girls, but that's not to say it doesn't happen to boys too. It's just as important issue to address among our boys as well. So what about risk factors for depression and anxiety? So of course, biological inheritance is always going to be a factor for almost anything, right? But what we're saying here is maybe depression or anxiety is genetic, could run in the family. Maybe mom, aunt, grandma, they all have depression or anxiety. Of course, this goes beyond that though. Environmental factors also can play a key role. So for example, bullying Bullying is a big risk factor for depression. Going back to puberty, girls, we learned that girls are sometimes viewed as sexual objects when their bodies are maturing. This can make them feel more self-conscious and potentially lead to anxiety or depression, or both. So just some examples of factors, environmental factors. And lastly, cultural values and stereotypes. So for example, parental control based on gender can be very different in the household. If there's, a brother and a sister, they might be treated very differently. Girls tend to be granted less freedom than boys in the household. And sometimes parents even become more restrictive once their daughter is sexually mature. And usually it's good intentioned, it's to protect them, but we do see these differences, and these high levels of control could actually contribute to feelings of anxiety and depression. So what are some treatment options? So the ones we probably heard of are attending therapy or taking medications, and both can be very effective treatments. Another one we may not have heard of is called CBT. This is a form of therapy. It could be considered that. It's called cognitive behavioral therapy. So yes, it is a form of therapy, but it's based on a theory that depression and anxiety, they're often stemmed from negative thoughts and poor coping behaviors. So like the little chart we could see here, it's actually looking at the interconnections between thoughts, feelings, and behaviors, kind of how it's a cycle that feeds into each other. So it builds upon this framework, and it's designed to help adolescents develop adaptive communication and problem solving skills. It's designed to monitor and regulate their changing emotions, so capturing them in real time, and scheduling time for themselves for enjoyable activities or relaxation, sometimes overlooked, right? When we get caught up in our day-to-day lives. So these are just some of the features of CBT. So you may have heard of this before. I know it's becoming a little more commonly talked about. There's even apps out there that are stemmed in CBT. If you wanted to check some of those out, might be helpful for you if you think. But yeah, I just wanted to share some treatment options for depression and anxiety because they are very serious things, and left untreated, they can pose a lot of risks, right? And really impact quality of life. So it's important to seek treatment and encourage treatment among our adolescents who might be going through these things. Now a different area, switching gears into eating disorders. So as we know, puberty comes along with an increase in weight. For boys, this increase usually comes from gains in muscle mass. For girls, they usually experience gains in body fat. We learned about this, so we see very different areas of development in their weight. So these are very normal changes, but they can bring psychological consequences. And this is going to differ based on gender and culture. So in many cultures, for example, bulking up is valued for boys. It creates an athletic advantage, just something that's valued among boys, what they're socialized into. And being buff is perceived as attractive. That's another factor. And boys who do not meet these standards of being lean and buff can suffer mentally and emotionally. For girls, there's also a lot of pressure to have a certain body type. So ideal body types we see in TV, movies, social media, even dolls given to young girls can communicate body standards of what's beautiful, kind of that hourglass figure, right? And I will say that we have come a long way with this, with representation and body positivity in the last decade, especially. It's a lot different nowadays from when I was a youth, the things I'm seeing. And I'm glad that that is happening. But that's, while there have been improvements, there's still a long way to go. So I just wanted to acknowledge that. Now, what are the repercussions of negative body image that I just described? Disordered eating patterns. So things like fad diets, cutting out entire macro groups like carbs or fats, taking drugs to suppress diets, taking laxatives, excessive exercising. These are all disordered eating patterns. And these things can eventually lead to an actual clinical eating disorder. So For example, anorexia nervosa. This is intentional self-starving. Bulimia nervosa is binge eating followed by self-induced vomiting. And lastly, we have unspecified feeding or eating disorder. Now, this is when the criteria is not quite met for the other two, but there's still symptoms of an eating disorder. So it's actually the most common diagnosis for adolescents. And recovery is very difficult. There can be serious health implications, like frequent relapses, especially for anorexia nervosa. Also, other psychiatric problems can accompany eating disorders oftentimes. So going back to depression, anxiety, and even substance use can sometimes accompany eating disorders. Recovery does seem more promising though for bulimia nervosa and this last one here, unspecified, actually has a 60 to 75% recovery rate. But nonetheless, the outcomes can be very serious, and eating disorders illustrate the pervasive outcomes of diet culture and body standards on our teenagers. So let's end here by talking about externalizing. We haven't given this too much attention yet. So delinquency and externalizing behaviors and problems. So specifically, we'll look at delinquency here. So as a recap, this encompasses things like skipping school, substance use, getting into fights. So as we said earlier, the gender differences are reversed from internalizing problems. So externalizing problems like delinquency are much greater among boys than girls. And age of onset matters here. So when do these externalizing problems begin? This can make a difference. So first of all, we have adolescent onset. And as this implies, it emerges in adolescence. So this is when externalizing behaviors start in adolescence, and it tends to be fairly brief. It typically declines into young adulthood. So you could think of it as it comes and it goes. Now, childhood onset is a different story. So this is where there are high levels of aggression in preschool, and it's persisting throughout childhood into adulthood even. So for boys, it's often a mix of having a naturally feisty temperament in early years and receiving inconsistent parenting in early childhood. So these two things often will combine as kind of a mismatch, not a great combo. So maybe the parents lack necessary skills to cope with this feisty temperament their child has. It can be a lot to keep up with. So maybe their strategy is to ignore inappropriate behaviors or to use excessive punishment instead of being met with understanding, patience, and guidance. So this increases the likelihood that once this child begins school, they're already aggressive and under-socialized. And by middle childhood, they tend to be more rejected by peers and to perform poorly in school. And by adolescence, they may start forming alliances with other peers with similar tendencies, deviant, delinquent tendencies, which reinforces the externalizing behaviors. So as you can see, it's a very powerful trickling effect. It starts very early in the early years and continues building itself and creating new challenges over time and persisting even into adulthood. So it's a very serious thing, and this childhood onset of externalizing and delinquency and how it transforms over time, how it builds upon itself. Now, there's not much research on externalizing behaviors in girls. As we said, it's less common for them, but it does still occur. So we don't want to forget that it doesn't mean it doesn't happen among girls. It does, but there's definitely more research on boys, which is why we shared about this childhood onset in the scope of boys. So that concludes this section. We're going to end the day on a shorter note, talking about, and a more positive note, talking about positive youth development. But for now, we'll stop here, and I'll see you as we continue along.